Yuma, hello everyone. I'm speaking today from the country of Ngunnawal, Ngunnawal and Ngambri peoples. I'd like to offer my respects to elders, ancestors, knowledge holders and all those who've cared for country and kept culture strong. I also want to acknowledge all the country that supports us to meet virtually today, all the mob tuning in to listen online, and particularly the elders and ancestors from whom we draw strength. In the language of the country that I'm on, Jan Yamaba, thank you. My name's Bronwyn. I'm connected to Gundungurra people from the Barragrang Valley. I'm a researcher at Yadurrawalani, the National Centre for Aboriginal and Torres Strait Islander Wellbeing Research. And today I'm speaking on behalf of the team whose names are on screen about some work we've been doing over the past year or so, tracking mental health and wellbeing of mob over the referendum period and beyond. Thanks very much to Guy Dewey for inviting us to be part of this webinar series again. We spoke as part of this series in March last year with some earlier results from this project, which had data from before the referendum. But today I've got some shiny new results for you that include additional data from 12 months since the referendum, as well as a bit more detail on some of the measures that we've been using. So hopefully there's something new even if you tuned in last time around. Before I get into the project itself, just a bit of context about our centre. We're very fortunate to have been gifted a language name by local Ngunnawal elders. Our name, Yadurrawalani, means strong, healthy place. And we're really honoured by that name as it reflects what we are aiming for in our work. We've got several different teams in the centre doing different things, but we're all linked by the goal of strengthening the health and wellbeing of Aboriginal and Torres Strait Islander peoples everywhere. And our guiding principle is to be in service to mob. We've got different programs across the centre, as I mentioned, including teams that focus on culture and wellbeing, or the cultural protective factors that help keep us well and strong, as well as settler colonial risk factors that harm us and what we can do about that. We also have other teams that focus on eliminating harms from tobacco, cancer, and chronic disease, keeping us well that way. So if you're interested in more detail about the centre, the QR code on the slide will take you to our website. I work in the culture and wellbeing team, and today I'm sharing some results that use Mayi Kuwayu Study data. So the Mayi Kuwayu Study is led by Professor Ray Lovett, who is a Nyempa man, and Mayi Kuwayu is a phrase in Nyempa language that means to follow people over time, which is what happens in longitudinal studies like Mayi Kuwayu. We gather data from the same people at multiple points in time to see how things change. And so Mayi Kuwayu is gathering data from Aboriginal and Torres Strait Islander adults aged 16 years and over, about lots of different aspects of health and wellbeing as well as culture. So we can see not only how things change over time, but also how culture and wellbeing are related to each other. The Mayi Kuwayu study was designed by and for mob over a 4-year period that involved focus groups with almost 200 Aboriginal and Torres Strait Islander individuals in different communities, and we embed Indigenous data governance throughout the study. The first wave of data collection started back in 2018. There are over 10,000 participants in wave 1. The second wave is being collected at the moment, and the third wave is in the planning stage, and we're hoping to start data collection on wave 3 later this year. We often joke that it's not just a longitudinal survey, it's also just plain long. There are a lot of questions in the survey, so 106 in the Wave 2 questionnaire. So we collect lots of data about all sorts of things. Cultural practices, language use, time spent on country, doctor-diagnosed health conditions, exposure to risk factors like settler colonial risks like racism and stolen generations, and much more. Today we're going to look at just some of the data that we've been using to get a sense of how mental health and well-being has been tracking over the period leading up to the referendum, and then what's been happening in the years since then. And this is a project that was funded by the Department of Health and Aged Care, and there were two main parts to it, a qualitative component and a quantitative component. So the qualitative component consisted of focus groups or yarns with mob that were designed to identify concerns and service needs in the lead up to the referendum. And we spoke about this in our previous webinar, so I'm not going to cover it again today. But if you're interested, you can find the reports and the fact sheets from that part on our website, and the QR code on the slide should take you there. But it's the second part, the quantitative component, which is ongoing, that I'm going to tell you about today. And for this series of quantitative analyses, we looked at a handful of different variables that were informed by what the focus group participants told us in the first part of the project. And these are variables related to exposure to discrimination and racism, mental health, social and emotional well-being, general health and well-being, as well as family support, cultural connection, self-determination, and health service use. So things that people told us that would be important to look at over the referendum period and beyond. So for each variable, we compared the prevalence across 4 time periods. So there's a baseline period, which included almost 10,000 Aboriginal and Torres Strait Islander adults from our first wave of Mayi Kuwayu data collection, and that spanned the middle of 2018 to mid-2021. Then there was the year immediately before the referendum period, which was before the public discussion around the referendum really started to ramp up, and there were 2,176 people in that sample. Then there was the referendum period, which was from February in 2023, when the formal campaigning kicked off, up until the day of the vote on October 14th. There's almost 1,300 people in that sample. And then there's the post-referendum period, which is from the day after the vote up until 12 months later. And there are 1,146 people in that sample. And just on that note, I'd like to take a moment to acknowledge and to thank all of the participants in the Mayi Kuwayu study who've shared their stories and their information with us, and taken the time to answer the many questions in our survey. So each of these numbers here corresponds to a person, and without their generosity we wouldn't be able to generate the data such as we have in this project. So a massive thank you to all of the participants, to the community researchers and the organisations that we partner with to support data collection. We're really grateful that you share your stories with us, and that we get to work with you and compile this collective data to help support better wellbeing for mob. And so what we did with this data is that we looked at the prevalence of the outcomes among the people in each of these 4 samples. So repeat cross-sectional analysis. And we used data from the National Census to weight the estimates from our cohort to get a better estimate of how prevalent these things are in the total population of Aboriginal and Torres Strait Islander adults aged 18 years and over. Now, before we get into the results, I just want to point out that some of the data that we'll be presenting today can be a bit difficult to hear. It concerns racism, discrimination, psychological distress, and the trends that we're seeing aren't great. So if anyone needs to step out at any point to take a breather, or to attend to self-care, or if you just get sick of looking at graphs, there are a lot of graphs coming up and lots of detail in the next few slides, so please don't hesitate to step out and grab a cuppa if you need to. So these graphs on the next couple of slides are all weighted prevalence values on the vertical axis. So the percentage of the total Aboriginal and Torres Strait Islander adult population, so aged 18 years and over, who reported experiencing the variables listed along the bottom axis across each of those 4 time periods I described. So for each variable, there are typically 4 columns, one for each of those time periods. So baseline in purple over on the left, then pre-referendum and referendum periods in the middle, in the blue and the teal, and then the post-referendum in green over on the right-hand-most column. So they're in time order from left to right. Now, you might be thinking, what's the story over there on the right-hand side? That only looks like 3 columns, and I'm sure you just promised us 4. What's the story there? Well, that's a great question. Thanks for asking. There are only 3 columns over there because that vicarious racism questions weren't in the Wave 1 questionnaire. They were only introduced in Wave 2, so there's no baseline data that we have for that. But for each of the time periods that we do have data for, we tested for significant differences in the prevalence compared with each of the previous time periods. So the asterisk hovering above the column means that there's a significant difference from the baseline. If there's a hash symbol, it means there's a significant difference from the pre-referendum period. The caret symbol, or the pointy bit of the up arrow, means that there's a significant difference from the referendum period. So if you look over on the left, you can see that the percentage of adults who experienced any everyday discrimination has increased compared to both baseline and the pre-referendum periods. In the 12 months since the referendum, the prevalence of everyday discrimination was 74%, which is about 10 percentage points higher than it was at baseline. And this corresponds to about 50,000 people. So that's an additional 50,000 Aboriginal and Torres Strait Islander adults experiencing everyday discrimination in the post-referendum period compared to baseline. And I want to point out here that this measure of everyday discrimination doesn't encompass all forms of discrimination, so it's possibly an underestimate of the true extent of discrimination that's being experienced. But what we measure here is an aggregate of 8 forms of everyday discrimination. And these are the questions that we ask in the survey. And so the first 8 are what's represented in that everyday discrimination graph on the previous slide. So these are things like being treated with less respect than others, receiving worse service than others, being followed around in shops, watched more closely, being insulted or yelled at, being treated as if we're not smart or as if people are afraid of us, or being treated unfairly by police. So that's those top 8 items which were reflected in the graph on the previous slide, the everyday discrimination part. The bottom 3 items, they're included separately in the vicarious racism graph. So these include witnessing other Aboriginal or Torres Strait Islander people being treated unfairly, or hearing jokes or insulting comments about Aboriginal or Torres Strait Islander peoples. And so going back to the graphs for those bottom 3 vicarious racism items, you can see that vicarious racism has increased since the referendum. It was already very high in the pre-referendum and referendum periods, but it's even higher now at almost 78%. And the vicarious racism isn't the only thing that's increased since the referendum. Healthcare discrimination has too. And so over the past 12 months, it's about a 12 percentage point higher than at baseline. And so now more than half of Aboriginal and Torres Strait Islander adults experience one of the 4 forms of healthcare discrimination that we've measured in this analysis. And this is what those measures are. So these are the questions on healthcare discrimination from the Wave 2 survey. So the graph on the previous slide only includes these first 4 items. So these are about healthcare providers not listening to or hearing what I say, as well as experiences of waiting longer or receiving worse care than other people, and going home without the care that's needed. So in the 12 months since the referendum, over half of Aboriginal and Torres Strait Islander adults experienced at least one of those 4 things. Now, the additional 6 items underneath them, the 6 items on the bottom of this screen here, They were introduced in the Wave 2 questionnaire, so they look at different aspects of discrimination and racism in healthcare, and they weren't included in this project because we don't have the baseline data to compare them to, but we are planning a validation study looking at all of these items and then hopefully some additional analysis to get a richer picture of experiences in healthcare. But zooming back out from these items to the overall picture, what we can see here is that discrimination and racism are pervasive, and they've been increasing for many people over the past 4 years or so. And for some aspects, things are even worse now than they were in the lead up to the referendum. And given that discrimination and racism have been increasing, it's not surprising that we also saw some change in some aspects of mental health. So here you can see that the prevalence of high to very high psychological distress increased in the referendum period compared to baseline, and it's remained high since then. And this was about 3.5 percentage points higher in both the referendum and the post-referendum periods than it was at baseline. And in the 12 months since the referendum, we also see an increase in anxiety compared with the referendum period. So that's now sitting at around 34% of Aboriginal and Torres Strait Islander adults experiencing anxiety, which is higher than it was at baseline. And we should also note here that the items in the Mayi Kuwayu questionnaire for anxiety and depression are doctor-diagnosed measures, so there'll be a time lag between any change in the experience in the population and then seeing them in our numbers. But the psychological distress measure is a more immediate and timely measure of how people are going, given the questions that comprise that measure. Other measures that will give a more immediate picture are these general wellbeing measures, so good general health, high happiness, high life satisfaction, all self-reported measures. They're all still fairly high overall, with the majority of adults reporting having good general health or high levels of happiness, high levels of life satisfaction. But we are seeing significant decreases in all three compared to the baseline, and notably with good general health. This is a 14 percentage point drop compared to the baseline period. So now only 59% of Aboriginal and Torres Strait Islander adults report experiencing good general health, whereas this was 73% at baseline. And while the analysis that we did doesn't allow us to draw any conclusions about causation, because it was a repeat cross-sectional analysis, it's not surprising that we're seeing decreased general health and happiness at the same time as increased discrimination and racism. And when we look at measures that contribute to good health and happiness and life satisfaction, such as measures of family and community support, you can see that many of these have suffered in recent times too. So I know this is a busy slide, I'm sorry, there's a bit going on, but if you just compare the baseline to post-referendum, so look at the green on the right compared to the purple on the left in each of these sets, the green is generally significantly lower than the purple, or the post-referendum is generally significantly lower than the baseline for most of these measures. So these are things like people's sense of their family always being there for each other, getting on and coping in the hard times, their family accepting people for who they are, but also people's sense that their family has good support from mob. And for many of these, we're still seeing an overall majority of people saying that they have strong family support, which really speaks to the strength and the resilience of mob in the face of what's been experienced over the last few years. And we also didn't detect any significant change in the last 12 months compared to the immediately previous period. But looking at where we are now, compared to the situation in 2018 to 2021, it is worrying that we've seen some substantial decreases in these important aspects of support and well-being over those last few years. We also looked at some cultural connectedness measures, and here we see some good news, and that a smaller proportion of people are feeling disconnected from culture, or to flip that, so you don't have to do the mental gymnastics, a greater proportion are feeling connected to culture. And hopefully that's something that can be built upon to support wellbeing going forward. What's not so great is that since the referendum we've seen an increase in people feeling torn between their Aboriginal and or Torres Strait Islander cultures and non-Indigenous culture in the 12 months since the referendum. But we're still seeing high levels of participation in social events related to Aboriginal and Torres Strait Islander peoples, and we've detected no change in that in recent times. So to summarise the changes we've observed over recent years, we're essentially seeing increases in stressors like racism and discrimination, some forms of which have continued to increase since the referendum. And at the same time, we're seeing decreases in some of the protective factors that help buffer against those stressors, like family support. And so it's not surprising that we're seeing declines in some measures of well-being, like general health and happiness and life satisfaction. We are still seeing relatively high levels of well-being despite the high burden of discrimination and psychological distress. It's likely that these high levels of well-being are underpinned by the high levels of family and community support that we're seeing, as well as the strong connection to culture that we're seeing. But it is concerning to see that many of those protective factors, the sources of family and community support, being eroded at the same time as discrimination and racism are increasing. So there's clearly a need for more culturally safe support services, not just clinical treatment, but programs to bolster family and community wellbeing and connection to culture. That was an important thing that focus group participants spoke about in that first part of this project. It was the need for preventative care, not just crisis care, but also holistic cultural programs, programs that are not just about individuals, not just individuals and individual well-being, but they're also about families, communities, and make safe spaces to connect with community and culture and country. And at the same time as these broad support services and programs, we also need elevated action to eliminate racism and discrimination. And this is not just about the kinds of interpersonal discrimination that we've measured in this study, but the whole system of racism. We've also been seeing increased structural racism since the referendum, and that's something that we've recently written about in a separate project. So there's an article in the Lancet Regional Health Western Pacific talks a bit about that. So if you're interested, keep an eye out for that, or feel free to get in touch with me. But more broadly, looking at actions on addressing the whole system of racism, there's an excellent report that was prepared by First Nations Co for the Australian Human Rights Commission that's based on yarns with MOB, almost 500 contributors they spoke to. And that report sets out several recommendations for addressing racism, so including around legislative reform, accountability mechanisms, standardised cultural safety education, and having a standalone anti-racism framework for Aboriginal and Torres Strait Islander peoples. So that report's well worth having a look at if you haven't already. It's really important that non-Indigenous people understand the impacts of racism and take action to help eliminate all forms of racism. One of the things our team has developed is a set of tools to help encourage action in that area. There's a video where some mob from our centre and some colleagues talk about the impacts of racism and their visions of a world without racism. There's a visual essay that steps through the results of another study that our team did that looked at the contribution that everyday discrimination makes to psychological distress for Aboriginal and Torres Strait Islander adults. And basically what they showed is that if we eliminate just those 8 forms of everyday discrimination that I mentioned earlier, we could halve the gap in psychological distress. There are also 2 checkup tools, one for individuals and one for organisations, And these are designed to help encourage non-Indigenous people and organisations to think about what more they can do to eliminate racism, and then to regularly check in and continuously improve on those efforts, not just being a tick and flick and forget exercise. So the QR code on screen will take you to those resources. If they're of any use in the work you do, feel free to forward them on to people you think could use them. There are also lots of other great resources out there. So WellMob has developed some resources on how to be a good ally and a range of other related things to do with racism. The WellMob site does an excellent job of collating and linking to resources developed by others as well. So all sorts of areas, but including dealing with racism, managing colonial load, and staying well. So lots of deadly stuff on the WellMob site worth checking out. There's also the new edition of the National Guide to Preventive Healthcare for Aboriginal and Torres Strait Islander people that was released late last year by NACCHO and the RACGP. Our team was involved in preparing a chapter on the health impacts of racism that's in this National Guide. So for any clinicians in the audience, that might be useful too. But that's all I had for you today. If you have any questions about the referendum project, feel free to email us. There's one more round of analysis scheduled in this project, which will include data up to 18 months after the referendum. So that should be coming out later this year. In the meantime, if you have any questions or if you have any ideas about how Mayi Kuwayu Study data could support the work that you do, please feel free to get in touch. For any mob who are listening and haven't participated in the Mayi Kuwayu Study, you can join the study at any time. You don't have to have started in Wave 1, so you can join at any point. If you'd like to participate, please have a look at the Mayi Kuwayu website, the links there on screen. And before I wrap up, I've just bombarded you with a bunch of data that's pretty heavy in terms of what it represents for mob in our communities. So here are those links to a range of self-care resources again. Now I reckon that many of you will be familiar with these resources. Some of you have probably been involved in developing them or running them. I'm sure there are many other great resources out there that I haven't linked on this slide, so feel free to get in touch with recommendations for other resources. But thank you very much for all the work you do in supporting mob. It's really important that you look after yourselves. So hopefully you can make some time today to do something to help keep your spirit strong. Thanks again for making time for us. I really hope that was useful.